Well, good morning. I would like to start off today by acknowledging, first of all, that I'm here with Dr. Eileen de Villa, our Chief Medical Officer of Health, and Councillor Paul Ainsley, who's the local councillor in this area. And we've got many representatives of the Scarborough Health Network who are doing such a wonderful job as our partners on the ongoing vaccination campaign and many other aspects of public health and delivery of health care to people in Scarborough. But before I deal with what is today one of our COVID updates that we would do, Dr. de Villa and myself, I would just like to acknowledge the fatal shooting that occurred in Scarborough, here in Scarborough yesterday at the David and Mary Thompson Collegiate Institute. Schools are meant to be safe places. The schools are meant to be safe for the kids and for the teachers and for everybody involved. Any violence that occurs at a school, or anywhere for that matter, but especially at a school, is tragic and it's unacceptable. And I want the families of the victim, the friends of the victim, and also all the students and all the staff and their families from David and Mary Thompson to know that my thoughts are with them. And I want the school board to know that they have our full support as a city, my full support as mayor in trying to navigate this difficult time. I know people may be scared by this kind of an event right now, and I want people to know that I hear them and I see them. It is heartbreaking to me that the lives of young people in our city are being taken through gun violence and at the hands of gun violence. As a city government, we have extensive new initiatives that we've been working on for a long time to help to address this, including root causes. And they've come about as a result of extensive consultation with the community, and the community involvement won't stop there. In fact, it's just the beginning of an even more extensive involvement of community organizations and community leaders in helping us to combat this gun violence. And I just want people to know that I'm committed to working with the community and with the other governments to address this problem. As I've said many times before, we can't do it alone as a city. At the top of this list must be to eliminate the presence of illegal firearms in our city. That in turn begins with asking ourselves a pretty basic question and having a discussion about that, a continuing discussion about that, namely, how would a gun find its way to a school to begin with, let alone being used in a tragic event like this? I want you all to know that I spoke to Chief Raymer about this. I've spoken to him more than once about this particular incident, and the investigation is well underway, and they will have more to say about that. Chief Raymer has made it clear to me, though, from the very beginning of this terrible tragedy, that no stone will be left unturned in the investigation and in bringing those appropriate to justice, and in looking at that question that he and I are discussing on virtually a continuous basis, which is how do we reduce the presence of these firearms in our city? How best can we do that? And, you know, without saying it's more or less important for these guns not to be in the hands of any particular group, how do we address in particular this question, this awful question of how young people increasingly young people at that younger age are having access to these firearms? And I just want you to know that he and I are talking about this all the time. We're trying to figure out what we can do about it. I think the measures that the city is undertaking are going to be helpful in that regard, but it's a very complex and extremely troubling problem, and I just want you to know I feel that way in my heart, and I know he does too. I urge anyone with any information about this particular tragedy to come forward and help with the police investigation. There are obviously many, many questions that need to be answered, and I'll be doing whatever I can to assist in finding those answers and to assist in these broader questions that I've made reference to this morning. So we are here in Scarborough for a different reason, and I am very pleased to be here with Dr. de Villa, and I thank them for coming here to Scarborough. Councillor Ainsley, of course, is here all the time. He lives here and represents these people in this part of Toronto so well. And we're here to report to you, as we have tried to do throughout the pandemic, on developments with respect to the pandemic and in particular our vaccination campaign. The provincial government announced yesterday that the next phase of reopening is set to begin on February the 17th, just a few days away. And that is good news for Toronto, and it's good news for the province of Ontario. It means that things can further open up and that businesses can welcome more people who in turn can continue along the path in their own lives of something that is closer to a normal existence. As a city, we are reviewing all of the changes announced by the province yesterday to see how it will impact on city policies and services and programs, and we'll have more to say about that in the next short period of time. What I do know is that this is a clear indication that the numbers are looking better and that the vaccines are working. The vaccine, as we've said absolutely throughout, and I relied consistently and continuously on the advice of Dr. de Villa and her great team at Toronto Public Health, in saying, when I kept asking the question, what more can we do? What more can we do? What more can we do? And the answer that came back, especially in the most recent months with Omicron and so forth, was to vaccinate, vaccinate, and vaccinate. And that is what we've been doing, and that is why we're here today in Scarborough. Campaigns like Vax The East become all the more important as we sort of take things hyper-local and continue to make progress on making sure every single Torontonian possible gets vaccinated. And today is one example of many in which Team Toronto is working around the clock to get Torontonians vaccinated. And the numbers are demonstrating that it's working. 91% of residents 12 plus have their first dose, and over 88% of residents 12 plus have their second dose. This has been steady progress week after week after week, and it is numbers that we're posting that are competitive with in any major city in the world. When it comes to third doses, the good news continues. More than 62% of residents in the City of Toronto have their third shot, and this is 25% increase in those numbers over that period of time. Similarly, for kids 5 to 11, we're making progress as well. 55% have their first dose, which means that 116,000 kids have stepped up and helped us to fight the pandemic for themselves and for their families and for the others they come into contact with at the schools. From January 31st to February 13th alone, the last 2 weeks, there have been 19,370 doses administered to 5 to 11-year-olds in the City of Toronto. These numbers are good, but more work definitely remains, and we are not giving up on this. In fact, we're redoubling our efforts with this very hyper-local approach that includes Vax The East. And so that's why we're here at Eastview Public School in Scarborough for the next phase of Vax The East. And it's very much focused on the East End, but also focused in the second stage after a very successful weekend at the Science Centre and in Thorncliffe Park. A very successful weekend, but now followed by quite a focus on clinics in schools. On the weekend, more than 1,760 people were vaccinated at the Science Centre and Thorncliffe Park Community Hub. 69% of those who showed up to get vaccinated were walk-ins. And this is a good thing, because it means that if we make it convenient, then people will come. And continuing with this convenient, hyper-local approach, we launched Vax The East Scarborough yesterday, and it continues through this week. And it's bringing mobile pop-up clinics to up to 6 schools every single day this week throughout Scarborough, providing convenient access to vaccines for hundreds of students and staff and parents, as well as members of the local community. The campaign runs until Family Day. Appointments can be booked in advance, but walk-ins are also available. And if you want more information, including a list of schools and how to book an appointment, you can find that at scarbvaccine.ca. So that's SCARB vaccine.ca. The Vax The East campaign will focus on neighbourhoods with lower vaccination rates. Yesterday, for example, we focused on Malvern, Morningside, Scarborough Village, and Tam O'Shanter-Sullivan neighbourhoods, and today we will focus on the West Hill area. And despite this continued progress, we've had some neighbourhoods that have fallen behind. And there's been an absolute resolve on the part of Dr. de Villa, Councillor Cressy, the Chair of the Board of Health, myself, and the other leadership team at the City in terms of our vaccination campaign, that we are determined to see that no neighbourhood, no person is left behind, and that it's up to us to take the steps that we're taking, including the hyper-local clinics, including our ambassadors who are out knocking on doors, every step we can take to make sure that no one is left behind. And so that is what we'll continue to work on. In that regard, we've sent out voice messages with vaccine and Vax The East clinic information to thousands of households identified by Toronto Public Health as being eligible for a vaccination. And we have the ambassadors out knocking on doors, and we have people sharing information and getting over some of the hesitancies people have about getting vaccinated. We've translated clinic and other information about vaccines into more than 10 languages that are in broad use in this area of the city: Tamil, Tagalog, Bengali, Urdu, Farsi. These are the top 5 non-English languages spoken in the neighborhood that we're in today. And these are the kinds of efforts that we're making, an all hands-on-deck effort to make sure that we can reach out to people who, as yet, haven't taken advantage of the opportunity to be vaccinated. I want to just conclude by thanking the partners that are helping to make this possible, because the city can't do this alone either. In particular, I want to say thank you to Toronto Public Health under the direction of Dr. de Villa and Councillor Cressy, the Scarborough Health Network, the Scarborough Ontario Health Team, as well as the Michael Garron Hospital, East Toronto Health Partners, the Science Centre, Toronto Community Housing, the Toronto District School Board, the Catholic District School Board, the TTC, and other Team Toronto partners. And I would just say to you in particular that the principals and the directors and the teachers at the TDSB and TDCSB school boards have been particularly helpful, and they have really made this partnership great together with Scarborough Health Network. For those not able to make it this week, there are still 5 city clinics that are in operation. You can find details of those at toronto.ca. There are hundreds of pharmacies offering vaccinations, doctors' offices, community health hubs, and there's a clinic at the Toronto Zoo. So that any of those are available for people to take advantage of. And I encourage anyone who needs a first, a second, or a third dose to book an appointment or to walk into one of our many clinics across the city. One final very important announcement to make, and details of which will be made available as well as appointments later on in the week. We're announcing that starting today, youth ages 12 to 17 years of age can receive their third dose if 6 months, 168 days have passed since their second dose. To date, about 94%, it's a great success story, 94% of residents 12 to 17 years of age have received at least 1 dose, and 90% have received 2 doses of the vaccine. So it now means that 28,400 residents in this age group are eligible for a third dose because they received their second dose on August 31st or earlier. COVID-19 for that group as well is our best shot at making sure they don't get sick and in turn put at risk people that they go to school with or work with or live with. And so I want to thank everybody that is stepping forward to get vaccinated of all age groups, and to again remind them this is the best weapon we have to continue the great progress we're making on getting back to a life that approaches normal after such a long time when people have made so many sacrifices. And on that note, I would ask Dr. de Villa to come forward and offer her update for today.
We're just going to take a little bit of a pause. We're having an IT issue, so give us 1 second.
So just confirming our sound seems to be okay. Thank you. And thank you, Mayor Tory, and good morning. As the Mayor said, it is wonderful to be here in Scarborough this morning at this school vaccination clinic. And also, as stated by the Mayor, for children and their families, schools are meant to be places of familiarity, comfort, and trust. So it makes sense, I think it makes good sense, to bring vaccines to students and their families right here. COVID-19 vaccines are safe and effective and provide essential protection, which extends to the child's household and the entire community. While children are less likely to get really sick from COVID-19, they can still develop serious complications from a COVID-19 infection. As a result of the emergence of the Omicron variant in December 2021, Toronto hospitalization rates in children and youth aged 0 to 17 years were higher than at any other time in the pandemic, peaking in early January of this year. Even kids who have really mild initial infections that don't require hospitalization can end up experiencing long-term effects which can impact multiple parts of the body, including the heart, the lungs, the brain, and the eyes. These are rare, but they're serious and can require hospitalization and may even require an ICU stay. And even if kids don't show symptoms of COVID-19, they can still spread the virus to members of their family and to other people in their lives. Children exposed to the COVID-19 virus who are vaccinated are less likely to get infected, and so are more likely to be able to continue attending school and to participate in other activities without disruption. Yesterday, as the Mayor just said, the province announced that all youth aged 12 to 17 who received their second dose of vaccine at least 168 days ago will now be able to receive the benefits of a third dose of vaccine. Initial data show that COVID-19 boosters help broaden and strengthen protection against COVID-19, including the Omicron variant. If you have questions about vaccines for you or your children, I encourage you to speak to a knowledgeable healthcare provider whom you trust, who can help you make decisions about your family's health. As Vax the East continues this week, I encourage every Scarborough resident who has questions about vaccines, whether for children or for adults, to call their primary care provider or use the Scarborough Health Network Vaxxed Fax service. Bringing vaccines to where children live, study, and play, like our Team Toronto partners are doing today, right here in Scarborough, is key to ensuring every child and their family members have access to COVID-19 vaccines. Now is an ideal time for parents and their children to receive their COVID-19 vaccines if they have yet to do so. It's the best protection available against COVID-19. It's the best protection for them, for their friends, for their families, and for our community. So with that, I'll wrap up my remarks and I'll turn it over to Lavin to moderate the questions.
Thank you, Dr. de Villa and Mayor Tory. We will now take questions from the media. As a reminder, it's one question, one follow-up. When we say your name, we will unmute you. So first up, we have Christina Tenalia from CP24. Go ahead, Christina. Oh, Christina. Oh, she has actually left. So next up, we have David Ryder from the Star. Go ahead, David.
Good morning, both. First question, I think, is for both Mayor Tory and Dr. de Villa, that there seems to be a push to get rid of the remaining restrictions and vaccination mandates, including like the ones we have for city employees coming from the provincial government. I'm hoping you can comment, is Toronto kind of in line with what the Premier is saying as far as a timetable? I mean, there's talk about March 1st, not having to need vaccination mandates, or are there some protections here that we're going to need longer than the rest of the province?
So why don't I start, David, and then I'll turn it over to Mayor Tory to add his comments. As you've heard me say before, my perspective on this is one of cautious optimism. We've actually seen significant improvements in our current situation as far as our COVID-19 circumstances are concerned. Just going over today our figures, the numbers, and how the COVID-19 epidemiology looks in the city at this point in time, we are certainly seeing signs of improvement. We realize that case counts are not fully reflective of what's actually or completely happening in the community, but certainly are seeing improvement there. Percent positivity is going down. We're seeing a decrease in hospitalizations and ICU admissions, and are certainly seeing positive signs in respect of our wastewater signals as well. Also, I would make note of the fact that we're seeing a declining number of outbreaks in the various city settings around the city. So many features that are moving us towards taking a more focused approach and using the tools that we have available to us, vaccines, treatments, and other self-protection measures to help support the rest of the way through the COVID-19 pandemic. When it comes to the city policy, as the Mayor mentioned, it is something that is absolutely being looked at this point in time, with the provincial announcement having been made yesterday. And my sense is that we will have more to say on this in the days to come, but certainly are looking forward to what I describe as an era of cautious optimism, and of course continuing our work to accelerate vaccine as much as we can, recognizing its protective benefit for our entire community and for us as individuals. So I'll turn it over to the Mayor, see if he has anything further to add.
Well, I can't add much except to say this. There is a suite of issues arising out of continued progress and the cautious optimism that Dr. de Villa has, which I share, which includes the reopening of city buildings and the return to more normal services. It includes how we handle the question of how, as we go forward, people can be admitted to the other different kinds of programs and facilities we have across the city, and other items such as the vaccine mandate. And all of these are under very active discussion on a daily basis, relying, as we have throughout, on professional advice to make sure that we do the right thing in the right way at the right time, and that I expect we will have more to say as we complete this analysis in the coming days with respect to our go-forward approach.
Thank you. My second question is just, I'm hoping maybe Dr. de Villa can elaborate a bit on that. We haven't seen any updated COVID figures for about a week now. You mentioned wastewater and some others. I guess I'm just hoping you can put it in context a little more as to how well we're doing compared to the peak, which I think was in late January. Like, are we back to where we were before Omicron hit, or how exactly where are we at in Toronto?
So overall, I would say not quite there, David, but certainly seeing improvements. So looking at our case counts, a significant drop relative to what we saw as recently as a few weeks ago. I know that here in the city, our daily case average was in the range of about 300 over the last couple of days, 300 new cases per day over the last few days. Our percent positivity has now dropped, into the 10% range. We were in the 30% range or above 30% just a few short weeks ago. And looking today at the number of active confirmed outbreaks that are happening at different settings across the city, we were well into the hundreds a few weeks ago, now decidedly below 100 active confirmed outbreaks. When I looked at the last data from yesterday, it was 81, if I've got the numbers correct. If it's not, it's very close to that range. So we are seeing definite signs of improvement, David, and I think that this is a result of all the concerted efforts that have been made thus far, certainly by us, by our Team Toronto vaccination partners, and by, frankly, the people of Toronto who have stepped up, gotten vaccinated to remarkable levels, as the Mayor just commented earlier. Again, I think our vaccination coverage rates rival those of any other major city in the world, and this is something we should all be very proud of. We have tools available to us to help protect us against COVID-19, and I think we're in a position to be able to use them in a more focused way so that we can see the restoration of many of the activities and services that we have missed, frankly, for the last 2 years.
Thank you. Next up, we have Momin Qureshi. Go ahead, Momin. Momin, can you hear us? Okay, one sec. Momin, do you want to try to unmute yourself?
Oh, yeah, sorry. Good morning.
Okay,
my
there you go.
screen was frozen there for a moment. Yeah, my question is both for Mayor Tory and Dr. de Villa, just following up on some of David's questions. Yesterday, we heard from the leader of the opposition at Queen's Park. She feels that lifting the vaccine mandates is basically caving to people who are anti-vax or refuse to get the jab, or even the protesters out there. And I wanted to know if you share those sentiments, if you think that lifting these mandates does kind of curry favor to people who have been steadfast about not wanting to get vaccinated.
So, Momin, why don't I start? I will say this, as I mentioned in response to David's question, actually what we have seen over the last several weeks is an improvement in respect of our COVID-19 situation. I went through some of the numbers. Our case counts are certainly improving, percent positivity improving as well, weekly incidence rates per 100,000 population, wastewater signals, active outbreaks. These are all moving in the right direction. And of course, we have seen, thankfully, the preservation of our capacity within healthcare, whether we're talking about hospitalizations or ICU admissions. Again, all of these things, thankfully, moving in the right direction. And of course, we're pleased to see that our healthcare system has, managed, what has been a very, very challenging time, because we know that it's important not only for provision of COVID-19 care, but for medical care writ large. So to my mind, that's what gives me the cautiously optimistic, perspective that I have. And that, coupled with the tools that we now have available to us, vaccines, treatments, self-protection measures, and the knowledge that we've acquired over the last 2 years is what gives me confidence as we move forward that we can use these tools in a more focused way that allows us to, yes, manage COVID-19, and at the same time to restore many of the other activities that are crucial to the experience of health and well-being for Torontonians and frankly for the province at large. I'll turn it over to the Mayor for his comments.
I can honestly say that throughout the pandemic, I have never looked at this as a question of sort of who's winning and who's losing when it comes to discussions that have been going on about political or other points of view on all of this. I have tried to rely in our decision making, we've made these decisions very much as a team on the professional, medical and scientific advice received from the professionals who are there to do that. And I've asked lots of questions, and I've asked questions sometimes based on opinions I've heard expressed by others because I think it's my job to do that. And so I think what we've been focused on throughout, quite properly so, is that the winner has to be the people of the City of Toronto who get vaccinated, who stay healthy, who stay alive, the healthcare system stays in a stable position where it's able to offer care to people, and that is what this is all about. And so the steps that have been taken and the ones that we will take in the City of Toronto following the discussions that are presently ongoing will be based on what is best for public health and what is best for the health and well-being, including the emotional and mental state of Torontonians and kids and families. But that's what we've done all the way through, and I don't think it served us badly. In fact, I think it served us very well as a city. It's why we're in a position that is relatively good, notwithstanding some tragedy that's occurred because of the pandemic compared to other cities around the world. And so we'll just continue with that approach.
Great, and just my follow-up, Mayor Tory, will be to you and to Dr. Villa as well. So I think most people understand the loosening of other restrictions in terms of capacity limits, even masking at a certain point, but I think most people felt the vaccine mandate was something that would make sense to keep for a longer term. So I just wanted to ask you, is this something that you would have liked to have seen stick around for maybe even a little bit longer, a few more months, a few more weeks beyond what is being offered here, just as that extra layer of protection there, or for comfort for people, really?
Well, everybody has to make their own decisions, and we heard Dr. Moore at the provincial level offer some views about things that were happening there that were announced yesterday and before. And as I've indicated, we're now engaged in our own discussions led by Dr. de Villa and the public health officials as to what is going to be best for the City of Toronto itself and for various decisions that relate to city programs and city installations and so on. And people have to do what they think is best, and we've tried to do that all the way along. And so it's not up to me to decide on what would have been better here or there. It's really up to us to decide what's better for our own city and take those decisions that are within our purview, and then to try and take the decisions made elsewhere and make the best of those in terms of trying to encourage people to get vaccinated, to follow good public health practices as we were doing at the very beginning of the pandemic, long before we knew about vaccinations. So that'll be my own response to that, and perhaps Dr. de Villa would like to pick it up.
So thanks, Mum. And I don't know that I have much more to add to that, other than to say that, of course, we're continuing to use the best available evidence and science to guide the decision-making process and to do what makes the most sense for the people of Toronto. That's always been my primary concern, and it will continue to be for the rest of for the foreseeable future.
Thank you. And then next up, we have Michael Bolduc. Go ahead, Michael. Michael, just give us a second. We're just trying to unmute you. If you want, you can go ahead and unmute yourself as well. Michael, can you hear us? Do you want to try unmuting yourself? Okay, if you want, Michael, you can just email me if you do have any questions. So that's it. That's the last of the questions. Thank you, everybody. Have a great day.